communities can mobilize to advance health equity? Dr. Giachello.
Thank you. Good afternoon. I'm really honored to have the opportunity to be here and be part of this important forum and webcast. And I also want to thank the staff and the members of the planning committee for putting such a successful event together. You already have heard a kind of a framework about health equity, social disparity, and the determinants of health, and a wonderful case study about how this health disparity, particularly in diabetes disparity, is affecting the Native American, American Indian. So my presentation would be describing a community-based participatory action research model and how the model can be applied by providing you a sample in community and system change level interventions aimed at addressing the social determinants of health. And we, again, need to be very clear that when we talk about health, we're talking about a state of complete physical, mental, and social well-being, and not just the absence of illness. And that the fundamental conditions and resources are needed for good health, and they include peace, shelter, education, food, income, sustainable resources, social justice, and equity. So it's important to keep that kind of definition and those elements in mind. And then obviously a definition for health disparity has already been provided, and what I want to share is that our community have a sense of urgency. Our community is hurting, and the disparity that exists in a number of areas is considered unfair, unjust, and avoidable. And I want to say that as a Puerto Rican, I speak fast, and when I have a lot to cover, I go faster. And sometimes I switch into Spanish, so let me know, any of you, if I am doing any of that in my presentation. But that's part of the style now that we are in this cultural competency and appropriateness, acceptance. There has been considerable amount of reason for this increased attention to health disparity. Obviously, the population is growing very rapidly, over 36% of the minority population right now consists in terms of the composition of the U.S. On the other hand, there have been increasing evidence, knowledge, data that clearly document the disparity. But on top of that, you also have President Clinton health disparity legislation, the Healthy People 2010 and 2020, they have tried very hard to really bring to the attention the scarcity of data to be able to come up with the kinds of measures that would help us to monitor the health of our country. You have the Institute of Medicine report, a landmark that already have been alluded to by Dr. Jones. You have the Agency for Healthcare Quality that is now monitoring a series of indicators in the area of quality. You have the World Health Organization commissioned Social Determinants Commission. They have really provided the leadership and the guide to move in that direction. You have CDC, the Center for Disease Control and Prevention. They have really been moving into allowing those grantees that receive funding to engage the community, for the community to be able to define the kinds of research problem and to build the kinds of partnership and focus on a number of activities aimed at community and system change, in addition to addressing the needs of individuals and family. And then you have a number of private foundations that have been providing increasing funding on health disparity. And you have the Let's Move campaign to reduce childhood obesity. They for the first time have brought more than 15 federal agencies to be able to address the problem of obesity that include the Department of Defense, the Department of Education, the Department of Labor, the Department of Agriculture. The list is about, like I said, 15. But it really clearly conveys a message about the importance of working into multi-sectorial effort. And then you have the Patient Protection and Affordable Care Act. I want you to be aware that with this particular piece of legislation that will come into full effect in the year 2014, in reality, there has been already a number of aspects and provisions that have been placed, that is currently in place, and that is helping the whole aspect of the health disparity discussion. Just think about race and ethnicity. That is already being standardized, and all the federal agency will be able to have not only standardization for race and ethnicity and other key elements, but also would be able to have what we call the class indicator, the cultural, linguistic, and health